Hello guys, this is Dr. Possibility from Excel Academy. Please make sure that you register with Excel Academy and make sure that you subscribe to our YouTube channel. In this video, I am simply going to focus on the posterior triangle, of which I'm just going to label some important parts that you need to understand when you talk about the posterior triangle. So let's quickly look at the first diagram. So we have been asked to identify or to label the marked structures. So we need to understand that when you talk of these structures, the first structure we can look at is structure number 1. So if you look at structure number 1, is simply the lesser occipital nerve. If you look at all these structures we are looking at, all these structures are just what? Just nerves. So this is just the lesser occipital nerve. So lesser occipital nerve. Okay, I'll use N to represent nerve. And then 2 is simply the greater auricular nerve. The greater auricular nerve. Okay, so greater auricular nerve. Okay, so this is one of the nerves that you are going to observe in the posterior triangle. And then the other nerve that we can look at is 3. And if you look at 3 is just the accessory nerve which is going towards the trapezius muscle. So this is just the accessory nerve. So the accessory nerve is the nerve which is simply going to innervate the what? The trapezius muscle. But this nerve, it also passes through the posterior triangle. And then the other nerve we can look at is the branch, which is just the supraclavicular nerve. So this nerve is just the supraclavicular nerve. Clavicular nerve. So the supraclavicular nerve is normally having the roots which is C5 and C6. The supraclavicular nerve is just having the roots which are C5 and C6. Then if you look at this nerve which is moving transversally toward the anterior triangle, and this is just known as the what? As the transverse cervical nerve. So this nerve is just the transverse cervical nerve. Okay, so if you observe these nerves, the way you can really understand them is that the greater auricular nerve, it normally moves as if it's going to your ears, and then this greater auricular nerve, it normally moves with another nerve which is just the lesser occipital nerve. And then the nerve which normally moves toward the anterior triangle, which is this triangle here. So the nerve which normally moves toward the anterior triangle is the one which is known as transverse cervical nerve. Then the nerve which is going toward the trapezius muscle is just known as the accessory nerve. So let me quickly move on and look at another structure of the posterior triangle. So if you look at the posterior triangle here, we are just simply much focused on the muscles and also on the bones. So the first thing that we can look at is the part which is marked by 1, and this is simply the muscle. So this muscle which is on the top, on the superior part of the posterior triangle, is just the splenius capitis muscle. So this is just the splenius. Okay, this is just the splenius capitis muscle. Splenius capitis muscle. I'll use M for muscle. Then when you look at the splenius capitis muscle, there are 3 sets of muscles that you need to look at, which are the scapular muscle. Which are the what? Scapular muscle. So the first The first muscle you can look at is the levator scapular muscle. So the levator scapular muscle, it is this muscle, okay, and this muscle you find it on the what? On the scapula. So this levator scapular muscle is a very important muscle that you need to check out on. So levator scapular muscle, which you would observe when you talk of the scapula. Number three, it is an important it's an important muscle. Remember, I talked of three groups of muscle which you need to understand, which are the scalene muscles. So we have the posterior scalene muscle, anterior scalene muscle, and also the middle scalene muscle. So if you look at this muscle, this is posterior, isn't it? So this is posterior. So this posterior is just the posterior scalene muscle. Posterior scalene muscle. So we have three groups of scalene muscles which we need to understand. So this is the posterior scalene muscle, and then we have the middle scalene muscle. Remember, this is in between these muscles. So you have 1, 2, 3. So this one is just the middle scalene muscle. Middle scalene muscle. Okay, so middle scalene muscle. Then the other muscle you can relate here, it is just the anterior scalene muscle. Anterior scalene muscle. So there are three sets of scalene muscles that you need to take note of. So you have one, the anterior scalene muscle, which is anteriorly and towards the anterior side of the body, and then the middle scalene muscle, which is between the scalene muscle and the posterior muscle. Another muscle which you can take note of, it is the omoid muscle, which is just this muscle here. So this muscle is the inferior belly of the omoid muscle. So we just look at this as the omoid muscle. So this muscle is just known as the omoid muscle. So please make sure that you understand this muscle. And if you look at this muscle is forming a boundary of the posterior triangle. Already we know this is just the clavicle. So number 7 is just the clavicle. Number 7 is just the clavicle, which is forming one of the boundaries of the posterior triangle. Then number 5, we can look at number 5, which is just the acromion of the scapula. So this is just the acromion of the scapula Okay, so when you label this part, you can simply look at this muscle and that other muscle. So the muscle on 4 is just the trapezius muscle, which is going to be innervated by the accessory nerve. So this is just the trapezius muscle, okay, and it is one of the superficial muscles of the back together with the latissimus dorsi. Okay, the other muscle we can look at is number 10. So when you look at number 10 is just the sternocleidomastoid muscle. So this is just the cleidomastoid muscle. Okay, so the sternocleidomastoid muscle, it is just a muscle which is normally separating the anterior triangle and the posterior triangle. So these are the labels that you need to take note of when you talk of this simple diagram. Then we have some structures that are related to the posterior triangle, and this can include the nerve, the veins, the arteries, the muscles, and other stuffs. So let me quickly identify these parts. So if you look at number one, which is this nerve here, so this nerve is just the phrenic nerve. So this nerve is just the phrenic nerve. So this is the same nerve which is going to innervate the diaphragm, the phrenic nerve. This is the same nerve which is going to innervate the diaphragm. So if you look at let's say there are some diaphragmatic injuries. This is a reason why you need to understand that when there are some diaphragmatic injuries, mostly you can notice that through the observation of the sensation on the right back of the neck, The reason why is that the diaphragm is mostly related to the nerve, and the phrenic nerve, it's making part of that contribution. Then the other one is the transverse cervical artery, which is this artery here. And these arteries are normally coming from the what? The subclavian artery as the main supply. So this is just the transverse cervical artery. So make sure that you take note of this artery. Then the other one you can look at is a branch of nerves. It's just a branch of nerves, which is number 3. So these branches of nerve are just going towards the hand, and this is just the brachial plexus. So this one is just the brachial plexus. So make sure that you are able to label that. Then number 4, it is a blood vessel, which is the suprascapular artery. So this is just the suprascapular artery. Okay. So with that being labeled, we can quickly look at 5, which is there. So when you look at 5, it is a red blood cell and the red blood vessel. So this guy is just simply the external jugular vein. So external jugular vein. So the external jugular vein is one of the important veins which you need to take note of. And if you look at the jugular vein is mostly related to the clavicle. So in most cases, when the jugular vein when the clavicle is being injured, the most vulnerable structure to be injured, it is what? The jugular vein, because it's the one which is close to the what? To the clavicle, because this is the clavicle. So when this part of the clavicle, which is most vulnerable, is being injured, you need to understand that the one which you easily be damaged is the what? The external jugular vein, or any other structure which is on this side. Number 6 is just simply what? So if you look at number 6, we can easily look at it, and you're going to observe that number 6 is just the clavicle. So number 6 is just the clavicle. So if you check at that, this is just the clavicle. So we have the external jugular vein, then we have the clavicle, and let's quickly look at number 7. So if you look at number 7, is just the thyrocervical trunk. So this is just the thyrocervical trunk. Okay, which is just a branch, which is just a part which is giving to a branch of what, of blood vessels. So this is just the thyrocervical trunk. Then we have the blood vessel which is coming from the thyrocervical trunk. Remember, this thyrocervical trunk will give rise to this guy, which is the transverse cervical artery. So this part of the name, which is cervical, is related to the branch it's giving. And then we have this guy which is going to get that other part, and this is the inferior thyroid artery. So this is the inferior thyroid artery. So we have the inferior thyroid artery. Then with that, we can easily look at the nerve. So this nerve here is just the vagus nerve. Okay, this is just the vagus nerve. And if you look at the vagus nerve, it's a very important nerve which will even pass through the diaphragm, and it will go up to the abdomen area, and it will supply structures there. Then we have number 10, which is just the common carotid artery. The common carotid artery. So this is just the common carotid artery. Okay, I'll use A to represent artery. And then the last one, which is 11, and this last one is just the internal jugular vein. So we have the external jugular vein and the internal jugular vein. So this is just the internal jugular vein. I'll use V to show the vein. Okay guys, I think we are done for today. Thank you very much for joining me. This was Dr. Possibility from Excel Academy.